So good afternoon, all of you. I know most of you probably know me, but I'm Brooks Stratford, president of NC Tech. I want to welcome you to the fourth quarterly session of our Government Vendor Network that we've been hosting for many years. As I alluded to a moment ago, we are recording the session and also live streaming. So we'll send a follow-up email to all the registrants with the recording of today's session in case you like to have that or pass it along, and also those who registered but couldn't be here, so that you get that recording and get it. A few updates before we get into our agenda. We have an annual online CXO auctions, say CXO because it's a mixture of CIOs, CISOs, and the like. We have about 40 this year participating. The proceeds of this each year help support NC Tech's work and our Education Foundation, which has a scholarship for young women who are graduating North Carolina high schools and going into a North Carolina higher education institution to pursue a STEM degree. So we appreciate the generosity of the executives who are in the auction lineup. And about 40, as I say, I encourage you to take a look. nctech.org is our website. You'll see it prominently featured there. The online live auction will be from noon Wednesday to noon Friday next week. Yeah, next week, noon Wednesday to noon Friday. So be sure to check it out, see who's available, and register to bid if you'd like. Also, the annual NC Tech Award celebration is coming up. This is our largest event of the year, normally in the latter part of the year, just because of availability of the convention center. It's a bit later than typical this year. It'll be December the 9th at the Raleigh Convention Center. We have announced finalists for the various corporate categories and are about to announce the winners of the individual awards. There are about 6 or 7 individual award winners that do get announced in advance. So be on the lookout for that momentarily. nctech.org/awards has all that information, as well as how to participate either as an attendee or to sponsor a category and have the chance to present that award, and other ways to be part of that. For today, I want to thank our sponsor for today's session, McGuire Woods Consulting. As is our custom, we'll also have a brief legislative update to close out our session. Ed Turlington and Drew Moretz with Brooks Pierce will offer that. But to bring a few words of greeting and to introduce our guest speaker, please welcome Bo Heath, who is a partner with the McGuire Woods Law Firm and is SVP and Director of McGuire Woods Consulting's Government Relations team. So Bo, thank you very much for supporting.
Thank you, Brooks. McGuire Woods Consulting is pleased to sponsor today's session of the NC Tech Government Vendors Network. As Brooks said, my name is Bo Heath. I'm the practice leader of the North Carolina office of McGuire Woods Consulting. Like our gracious host, Brooks Pierce, we're a full-service law firm and government affairs consulting firm with a presence in 10 states and Washington, D.C. We offer lobbying, public relations, advocacy, and procurement assistance to our clients. Today, we have the pleasure of hosting Vijay Ramanajan, CIO of North Carolina Department of Health and Human Services, a role he held on an interim basis last year before being named CIO in April of this year. Prior to that, he served as the deputy CIO for several years. Before beginning his government service, Vijay was a technology leader for 2 decades in the private sector. Vijay is no stranger to NC Tech, given that DHHS is a longtime member of the association. Please join me in welcoming him to today's session.
Thank you all. Hear me? Good?
Much okay.
Slide here. Thanks for the opportunity to allow me to speak here. Good to see a large crowd, and this is probably my first engagement with NC Tech. I think my panel leaders may have been in other conversations. So good to see a large size crowd here. I don't have the standard presentations. I'm not a PowerPoint guy. I hate PowerPoints, too many things. So I didn't bring any slide decks or anything. But I want to make it, I'll give you some high level view of what we do, what we're doing at DHHS. And then I can go into some of the priorities, as well as want to make it more of an open kind of conversations, or be able to answer any questions as we go along. That's what I want to cover here today. As I introduce myself, I've been with DHHS, I would say 5+ years now, and I've grown over a period of time. I joined as a director, and then eventually got into deputy CIO role, and then got into the CIO role there. Before that, I played several roles, and my primary area of experience has been all along in Health and Human Services, but more predominantly on the Medicaid side of the world, pharmacy benefit management, as well as health exchange program and itty-bitties of Blue Cross Blue Shield type of programs and plans. So run several of those over a period of time. What I can talk about is where we are on the DHHS journey, and then a lot of this is available publicly and more publicly also, but I try to cover as much as possible, right? I think all of you by now know is that we are living in a time of doing still the same work that we do, or doing even more with less monies or monies that we don't have. So that's the posture that we all have, and I'm sure you must have heard it in multiple state governments and federal government space also. That's not news to any of you all. So with that being said, we always have challenges on which is the priority and where do we go from here, right? So that's always been our challenges. We have several active projects going on, like some of you may be aware of it. I think we're very proud to have rolled out the whole electronic health record system, which was Epic as the base platform. It was a 2+ years initiative, and bringing together all the paper to electronic transformation for all of the DSOP facilities or the state-operated health facilities. We have 13 different state-operated health facilities that is under our agency, which basically deals with your psychiatric hospitals, your behavioral health, your alcohol and drug abuse center, and variety of school systems are also in those facilities. And it's not a typical healthcare system implementation for an electronic health record. I'm not sure how many of you have been to some of these facilities. A lot of these facilities across the state, they have a lot of paper stacks, and their workflow is that you put a sticky note, that means that the next person knows what to do next after that. And you fold the paper in a different way, and then you know that what the next person has to do, right? That is the workflow process that they had, and it was purely paper process in majority of those cases. Except for certain hospitals, like Central Regional Hospital, I think they had more robust electronic systems and all of that. But I think our challenge was to getting all of these different learning facilities together in a more common process, more common platform, and more common agreements on what the rules and workflow should be. We're still struggling, we're still maturing at this point. But I think that went live very well on August 1st, and well received, and the people are continuing to adapt into using that platform way forward. It had its own procurement challenges, and you all must be aware of all the procurement challenges we have there. We had to go and get, I would say, close to 40+ or minus different procurements. You cannot have everything all in one procurement for an EHR because of the way that business currently is run there. But I think we got past those challenges and eventually rolled it out. We are very actively rolling out a lot of the child welfare modernization. Some of you may know the history. Way back in 2017, we paused the rollout due to legislative study and government studies and other things. Ultimately, we started rolling out starting as early as this year and some portions of last year. So we have, I think we're getting close to rolling out to 89 some counties by early next week. And it's been a staggered rollout month over month to roll out a lot of the child welfare system. We call it as PathNC, you must have heard about it. Partnership and Technology Hub for North Carolina, that's what it stands for. And I think that's a very proud of what we were able to transform there to resolve past challenges as well as help our social welfare workers to be able to use our platform, and while they're in the late night weekends where they go and have these site visits, it's always challenging. And they may not have internet and all of that. So we wanted to make sure we are providing all those different capabilities along the way. And I'm moving my head around, but I'm not sure whether the mic is catching everything. Hopefully y'all can hear me, right? Okay, good. I think we with 89 counties by this Monday, I think we have rolled it out to Mecklenburg. Wade County is coming up next, which is happening this Monday. But along with that, we have Durham and all these other different counties that we are continuing to roll out there. But we are rolling out only a portion of it, the intake and assessment modules. And then the big ones is the ongoing case management will follow the same staggered rollout going into next year. So our goal would be by before summer of next year, we'll be done with all of the child welfare rollout of patents and all of that. So that's a big project for us. And we have other programs or projects also going on. Obviously, MES is continuous rollout there. I think sometime this November, we are rolling out the interoperability module that's going up. See some accents just shaking their heads. So I think we're excited for that. I think we kind of took over the management integration services, which was MIS platform. So we rolled it out earlier part of this year and we continue to enhance that. And then sometime next year, we'll have the PBL, Pharmacy Benefit Administration modules going on there. But I think from a Medicaid perspective, there's a larger roadmap and things that we are building up, and we have been working with CMS to get approvals in that space and eventually look at what the future state would look like. But I think that is going well so far in the Medicaid space. And we have other, I wouldn't call it a smaller, like most of all heard about the immunization information system that we are currently rolling out. I think we're partnering with EY on a lot of the training and change management aspect of it. I think Gainwell is our prime vendor for their product rollout there. So that is going pretty decently well at a decent pace. But I believe that sometime in spring of next year, we'll have that rolled out if everything goes well there. But that's a big change for us because it's a huge technology transformation. The previous system that we are using is called as immunization registry, and that's pretty old, like 15, 20 plus years, and they're going through a whole change management in that space. So that's going to be an interesting rollout there. I think as far as other portfolios, we do have some small things going on in the mental health space. I think a lot of you may have been heard about the rural health grants, and some of you may already be looking at that, what that looks like. There's a heavy rural health opportunity where we are working through with the rural health division, mental health division, and other divisions to see what those opportunities are and how we use that. That's all public information, the rural health grant. And I'm sure a lot of you may already be talking to our divisions and other areas there. Those are some big ticket items that are currently going on as we speak. Obviously, the fun topic is all AI. What are we doing with AI, right? I think my posture and my mindset and the team's mindset also is that to use AI where we need to use, right? We don't want to be left behind, right? Because it'll be by the time the hype gets over, that's when we will start hyping up, because that's typically the way we are lagging behind from a private sector perspective. But I think the team has evolved over a period of time, especially I think Medicaid has jumped ahead in the space, creating COEs, some governance and processes behind that. From an overall enterprise-wide, we are working across the agency to make sure we have the right enterprise-wide policy. How are we going to manage the risk around the cybersecurity, the data exposure, and all of that fun aspects of it. Hopefully, sometime early next year, we'll have some enterprise-wide rollout on top of what DIT might have, because DIT already has a lot of that stuff. And we are collaborating already with Isa on the other end, the Deputy Secretary for AI, and also with Secretary Piccioni and the rest of the crew to make sure that we are collaborating in a way that we don't repeat what they've already done, but we are doing things, layering things on top of that. Because we have a lot more PHI, PI type of data in our ecosystem, right? And our use cases are going to be different compared to DIT for the most part. So there is that partnership and coalition that we have been building. As you all know, the AI executive order was signed by Governor Stein, and there's a lot of AI accelerator type of initiatives that are happening. Some of the vendors out here may already be part of that ecosystem, working with DIT. I think that is a unique opportunity for us to submit our own AI use cases, it could be AI, Gen AI, whatever types of use cases, into that accelerator model. And then ultimately each cabinet agency will have the opportunity to experiment with at least 3 use cases with the respective vendor or solution. So if you're not, I thought would be to make sure that you have an opportunity also as a vendor to see how you all fit into that model if you're not already explored and talked to DIT about it. Or to the governor's office, how will your lobbying thing works there. So I think that's an exciting opportunity for us from an AI perspective to see how we can experiment and then eventually start using those type of use cases beyond what we already have. We did roll out AI type of a tool for child welfare. We call it as AskPath. And this is more geared about policy-driven type of, I would say chatbot, but not really chatbot, but also some intelligence information that is being gathered on child welfare policies, that sort of thing. So I think that is an exciting thing that we've been able to roll out last week or the week before is when we rolled it out. So I think our AI journey is like we still want to be part of that journey, and then we want to be, we call it as responsible use, but we also want to make it more meaningful on when do we really have to use AI and not necessarily every time AI is the best option there. We're not big, any Microsoft people here? I think we already know this. So we're not big fans of Copilot for many reasons. I think it is very cost prohibitive for us to roll it out for an entire agency itself. We tested everything. I think it works well in certain areas. In certain areas, it needs some improvements. But because of that, we are not able to. It's going to cost us $6+ million if you have to roll it out to an entire agency. As you all know, we have 17,000 plus or minus employees in our agency. But we are offering it for divisions with real business reasons why they need to use it, and then there's enough time and justification if they have the monies, then we can roll it out to for specific groups of people there. So that's the approach that we've taken for Copilot. We do want to get something like ChatGPT Enterprise license, if possible. DIT is working on that. I know it's there in the GSA Schedule 70 procurement vehicle already, but we are hoping that we'll get some kind of a state-term OpenAI type of licenses that we could use. That might be, we still cannot roll it out to the entire agency because then that'll be $3 million. You reduce the fraction of that cost if you're able to get it at less than $20. But that would be an opportunity for people to still use some kind of AI tool to be more productive and meaningful there. So that's our AI journey by itself. As far as my team, I'm not sure how much time I have. I can keep talking. I think ITD has gone through a lot of, ITD means IT division, nothing different about it. DIT, you switch DIT and you switch some letters there and become ITD. But IT is one of the 33 divisions that we have within our agency. We have 32 other divisions, as you all know, mental health, public health, social services, health benefits, they're all different divisions within our agency, and IT is also another division. At any point, some of the projects that I all told you, we have around anytime between 40 to 50 active, small and big projects going on at any point in time. And some of them are multi-year initiatives, as you can imagine, but we have that type of portfolios there. And I think we have a lot of applications that the team is responsible for running the operations, maintaining the security postures and all of that. That's probably around, I would say, 450 plus or minus applications that we have within the IT division that we manage. And then this is beyond the vendor applications that vendor hosts and vendor managers type of thing. But we collectively might look at probably around 500 plus or minus platforms or applications that we continue to maintain. And that's a large size portfolio that the division manages. We're also responsible for all the project management, portfolio management, and all that aspects of it that comes with that. And we, I think we have a new CDO, we do not know, Chief Data Officer. His name is Daniel Carnegie. He comes from a different background. Specifically, he's a doctor. He has multiple degrees and all of that, and so I think he brings a different perspective. Very nice guy. If you guys run into him, please do talk to him. Definitely. I think the data office initiatives are beyond just any bigger data analytics type of platform, and Medicaid is working through some of that over time. There's probably an RFI that came out a couple of months ago that some of you may have responded to. But I think with data, we're also looking inwards on how we can enable the data office to be able to make decisions from an agency perspective. For example, we at the beginning of this year, we had many challenges that basically one, we'll be in a meeting, and right after the meeting, there will be a grant that just ended. We have no freaking clue how to handle that situation, right? Okay, where am I getting this data, right? How am I going to make decisions based on, should I start some work or should I get into furloughs and other types of hard decisions we have to make, right? We have several systems, we have several spreadsheets, several databases, and then you have to bring a lot of those things together in order to make an informed decisions on what do we do with this information? Where do we go from here, right? And that was a recurring challenge. Honestly, even today, it's still a challenge. So the data office is more looking at how do we make those type of internalized decisions for the agency, right? And not the big bang, let's create a data analytics platform. There's still those initiatives, but let's create a data mart and all of that, right? We're also focusing inward, and that's where the data office is continuing to grow in that space. There's just so many opportunities internally to do a lot of this work. So that is on the same lines. We are also looking at reducing our operational cost overall, right? With the monies not coming in, our request and the way we are looking at is that I'm looking at even if it's a $3,000 spend, I'm really not. I'm saying no to it first before somebody convinces me to say yes, right? And the reason being that every dollar and every thing matters to us because when we don't have the monies that we expect to have there, right? So that's an operational efficiency perspective in terms of how we are fiscally having a better discipline. I think all my directors in the smart goals, Paul is here. They all can speak to the initiatives and the responsibility, the fiscal responsibility across the agency, including my own division. Where do we spend our dollars the best? If you do not know Paul is here. So Paul is my director of vendor and financials, and basically a lot of the vendor management, risk management, and all of that. But he's not going to be awarding contracts, so don't line up behind him. But I think his role is going to be very critical for us to understand that we have so many contracts, so many vendors we deal with. And how can we problem solve when we solved it in a different space, and how do we kind of transport that over here, right? And then overall, looking at SLAs, looking at financial responsibilities, and what does it mean, and it also go and chase why are we doing it this way type of thing, and then we continue to apply those lessons learned and apply in future state contracts and vendor relationship there. I'm excited for him to be in that role. In this space. And I think he's also dealing with a lot of the innovation lab aspect of it, like partnership with universities, partnership with nonprofits, where we could use some monies that we don't have, but at the end of the day, deliver some outcome. I think we have a good partnership with NC State, the Design Center. We're familiar with that. I think we got them to do a couple of initiatives. They didn't accept our initiative because we had to make sure we built the right best use cases that attractive to the Gen Z crowd. So we can get some traction. They accept our projects. I think he and the rest of my team did a fabulous job to get us there. So I think that's an area where he continues to focus, and I thought he would benefit from coming over here and having an interaction there. I think there's a lot of things, and my team is probably around 1,300 plus or minus people, including employees and contractors and then delivery solutions staff. That's all my team is. And we have 6 major portfolios, and each portfolio is organized by the type of business that we support. And we go by, we couldn't, because we have 33 divisions across the board, so we came up with color code like blue, brown, yellow, aqua, and those type of colors. And each portfolio has a bunch of business divisions that they support. And that's all they are aligned there. And each one of them has a director in that space. That's how we are organized. I think I said a lot. I don't think I said things that I'm not supposed to say, but that's okay. But I think a lot of this is public information type of things. I'm open to any questions or anything that you want to hear from me, that you didn't hear from.
Thank you, Jay. If I could ask that if you raise your hand, I'll call on you, introduce yourself and who you're with. So we have a sense of who's asking the questions and who's in the room. We appreciate that. So open it up to anybody who'd like to offer an observation or a question.
Councilmember Steve Rao, but also in the tech sector. What would be your advice then for companies that have an idea that they would like to work with Isa, the deputy secretary? Do they go to them first to showcase their idea, and then that proof of concept would be showcased to the agencies they think would be interested? Could you?
Are you specifically talking about AI type of ideas?
Yeah, for AI.
So yeah, I think I agree with that approach. I think Isa, depending on his time and right, he does not have a team because that's always a challenge for him, right? He has to work with multiple team members across the agencies. So my thought would be, if you're not already met with him, a great guy, a lot of knowledge, but I think it would be a good idea to go there. But we also, a lot of vendors come to us. I meet with a lot of vendors, and other divisions meet with a lot of vendors and all of that, right? We sometimes go and pitch an idea based on what our use case is, and then we don't need to put vendor's name there, but sometimes you have to get the right credit and all of that, right? So if you're looking at how do you promote an idea, definitely talking to us as an agency would be a good way. But if you're looking for specific AI, like if you want to be part of that accelerator group type of vendors, right? Then I think it's a good idea to talk to Isa and Secretary Picha. That's the way I would go about it.
Anyone else? We had Isa come speak actually a couple meetings ago, so he
Good.
gave us.
Yeah, there seems to be a lot of federal policy changes in Medicaid that are coming down, work requirements for expansion population. Do you have to figure all that stuff out?
Oh, yeah.
Put technology against
That's what I did not mention. So HR1 is a big thing for us, all right? I think a lot of vendors are coming up with different options, especially on the eligibility and enrollment aspect of it. It is a huge change and impact for us. I think Medicaid, there is still a lot of work group type of discussions happening, what really is needed because they have some more time there. But for a SNAP program governed by USDA, some of those requirements apply there, especially for the, they're familiar with the ABART. Don't ask me what ABART stands for, but ABART is another program that looks for work requirements. That requirements is getting very complicated that we have to do that. Right now, we are doing it internally because that has to be done in a very short order as soon as January of this year. And so we're already working through that pieces of it and moving forward in that direction. However, on those same lines, we want to make sure that the platform that is there is Kiram. Yeah, and we are not modernized out of Kiram, but everything that the E&E platform or NCFast is in cloud, it's an AWS cloud, right? So the opportunities are immense to use those tools available there, which we are doing. There are other sustainable model future AI type of things that we could do to help us to reduce the caseworkers' burden because they just have been having a lot of things thrown at them for the last 5-6 years, right? And, we already had a case load for all the counties, right? That's a sort of challenge. After I came on board, we kind of one of my biggest things is to really have enhance different types of experiences. And when I say that is caseworker experience, user experience, your developer experience, your on right? So we had to streamline and do a lot of changes to help the counties. And I think that built a different type of relationship and dynamics between the agency and the counties. And we were listening to them, and then we were able to really show and deliver those changes that helps their productivity, right? But then the pandemic came, and then there are more other challenges for them. And then you had all the standard plan, tribal options, and tailored plan that is also on it, right? Then you have the PAP NC rollout going on, right? And then you have Medicaid expansion. That was the other thing, right? We are all proud of all of that, but I think from a caseworkers and county perspective, it was just a humongous burden. With this HR1, it's going to have more burden on the frequency of the checking of the work requirements. Like every 3 months, they have to decredential or recertify in that space. That's going to be a huge work. So we are looking for sustainable options to AI or automate to reduce that casework. That's the opportunity to see, definitely on the SNAP area. And the same thing would be applicable in the Medicaid space also. I think we are planning to most likely submit a use case around all of that for both SNAP and Medicaid as part of the AI accelerator. Just for the governor's office, and they are very interested in it. So that's where we are on the journey. But I think Medicaid piece of it is sometime in August or next year, sometime in July or August is where I believe that's. We asked CMS for funding, and I believe that they will give us, but we do not know. USDA, we are not going to get a full amount of money with the current situation.
Others?
Charlie, I'm from Lighting Minds. We work on like AI solutions, AI products. So as you were talking about like AI accelerator program, and from DHS's point of view, we have some use cases. Is this public information or like kind of how? How do we know where we can provide any solution or like kind of?
So I'll answer the question in the same way I answered him,
Okay.
right? So what we are submitting may not be public.
Okay.
Okay. However, when that use case gets selected, because there are several processes, we are big on processes and governance and
Right.
committees and everything, so we do that a lot for the right reasons. But it has to go through a steering committee between the DITs and the governor's
Right.
office, is my understanding. And then it comes back to the agency where myself and my leader, Linda, will have to review and approve those things. And when we're ready, then it comes, at that point is where the vendor type of connection has happened. Until then, you may not even know what we have submitted.
But like how do you resolve your use cases like then? Because if no one knows your use cases, how anyone can provide any solution for you? Or
So-
like
No,
you
that's
have-
why the accelerator, right? And the
Okay.
way I believe it is going to happen, and ESA might have different thought process and ideas around all of this. When we submitted, the governor's office knows it already. So they can, their deputy COO, they are already watching all of these use cases coming. That's one of the key responsibilities that they have. And then it goes into the DIT and the steering committee aspects of it. In my mind, at that point, they are probably going to say that, hey, we have these type of vendor pools in the AI accelerator group.
Okay.
And then these are what they are offering, because I'm sure, and I do not know how the process works
Okay.
on the accelerator, getting on board on that. That's something the DIT can explain there in my mind. Then they're going to say, we have these 3 vendors who can do this, and then we get to go and do it with one of the vendors. We cannot do with every vendor because that is going to cost us more time and challenge that we don't have. Until then, you won't probably know would be my best guess. So. But we're still learning. I think we'll have to see how the thread kind of connects with each other.
Good information.
I've got one more, yes.
Hey, BJ, JR Mills with KPMG. You mentioned about reducing operational costs. Do you guys have any specific focus areas or initiatives that you're looking at?
Multiple places, right? Staffing is obviously our biggest spend there, right? And we'll have to still operate and retain the best staff there. We cannot arbitrarily say, okay, let's get rid of the staff and then suddenly we'll have a different problem there, right? That is an area where definitely we want to look for efficiency, but that's not the only area. Our license spend on software and hardware, right? We want to be very deliberate about beyond just a usage history is really why do I need it and do I still need it or do I still need this money, right? This goes back to the whole M365 Copilot licensing. If we roll it out, we're going to spend a lot of money and not. I would guarantee you that probably only 10 to 15% of the staff will be using it effectively, right? Is it worthwhile for me to roll out such a large product across the board, right? So licensing is another aspect of it. There are areas where do we really there's always the build versus buy type of thing, but that's a long-term thing depending on what you're looking at, right? Some of these large size initiatives we cannot literally build ourselves, right? We do need to buy, like which is where the procurement aspects of it comes there. But I think those are all some options that we have already looked at in terms of what are all the categories there. I think in our division, my challenge is that we're still trying to figure out, Kwam, myself, and the rest of the team are trying to figure out where are all our spends, right? Because with IT division, we have a budget, but we also don't have a budget. And the reason I'm saying that is we are cost allocated from those other business divisions. So whenever we do work for, let's say, Medicaid, right, the Medicaid money comes to our division. The money flows in and flows out, right? And then you have the factor of DRT, right? DRT bills us on a monthly basis for all the services that we are using there, right? So then that money we have to pay, but it is a pass through and then we go back again, right? So the accounting piece of it is very challenging for us to determine where all we could use the opportunity, but we know certain things that we can definitely do.
Thank you.
Vijay, thank you very much for being with us today.
All right, thank you.
As I mentioned, we'll conclude with a legislative update. Thing was going to go on paper. Rest.
Good afternoon, Ed Turlington and Drew Moretz with Brooks Pierce. BJ, thank you to you and your team for all that you do. I think everybody in this room knows you literally oversee the spending of billions of dollars to help thousands of people. So thank you for that. BJ, one thing you may know about past NC Tech meetings as I look around the room, not only do we have a lot of expertise in companies, but we're fortunate for those of us who advocate before government. We walked and worked together. Bo does a great job. Natalie, former chairman of the board of NC Tech. Steve, we all know. Chris, the former CIO. Eric, my law partner. Doug, of course, Brooks. So thank you for all of you who do government affairs in addition to us. So in the 90 minutes allotted to us for this part of the program, it's just a joke. We want to do three quick things. You probably all know the legislature's website is there. It's actually a great tool for finding information, and our contact info is at the bottom if you can't find something. So Drew, I'm a little confused. Why did the government not shut on June 30th when there wasn't a new biennial budget?
Unlike Washington, North Carolina has a continuing resolution baked in. So our fiscal year starts July 1st, runs through June 30th. So July 1st, because of the continuing resolution, we do not shut down. And every agency can run on the prior year's recurring line item from the budget. So we don't have the cataclysmic event of what's happening in Washington right now where people are getting paid.
Good. And many of you probably already know this. The omnibus budget bill, which has not been enacted into law, is Senate Bill 257, still pending, conferees in theory. And still work that out and hopefully will at a certain point. But there are two bills we listed here you may be familiar with that have been enacted in the last few weeks and months, often called mini budgets because of their size versus omnibus budget, but also with a limited number of items. Drew, there were some IT items in those two bills.
Yeah, absolutely. So last month, whenever they were in town, they were able to pass the mini budget. Senate Bill 245 had $50 million for DIT for cyber, non-recurring, so it was one-time money. And then $5 million for the architect, or for the administrative office of courts, also non-recurring for time limited technology and business processes positions.
And then as you can see, there was a bill passed last week that had additional money for the courts. So I certainly don't know the answer of when we will have an omnibus budget law. I'm still hopeful. These other government affairs pros may have an opinion. The lobbyist gossip in many circles is it might be a next year thing. You remember we have a 2-year session. And so at some point that bill may be the vehicle for this fiscal year. And the next one, there may be another one. The so-called regular even year session is scheduled to be in April 21. So stay tuned. Category 2, we just wanted to remind us all that there were some policy bills that had some movement, and we listed 5 of them, one which was enacted and 4 of which are still pending and may be considered. And then Drew, I thought the legislature left occasionally. Is that not true?
That is true. So after they did not have a budget starting at the end of June, they did adjourn. However, they allowed themselves the adjournment resolution to come back into session essentially 1 week every month between now and April of next year when the short sessions will start. So they have a November session, a December session, January, February, March, April, early April session. So they will be able to come back if they were to ever strike an agreement on a budget. So it's not like they're no hope whatsoever. However, whenever they left town this past week, it did not look good.
Brooks, is there anything you would add as the head of the association?
You covered it well.
Good. Well, thank you all, and we'll be around later if you need us.
Thank you, Adam Drew. Quickly, just wanted to again thank McGuire Woods for sponsoring today and allowing this to occur. Thank you for hosting this, as you always do. I want to remind you again about the CXO online auction. Please check that out, and also the NC Tech Award celebration, which will take place in early December. We will have 4 quarterly sessions of this group in 2026. We're working on calendar updates as we speak. So if your company or organization is interested in sponsoring one of those, please be in touch with me. And we will, as I say, also send out an email that has a recording of this session today, also the handout that was distributed, and ways to follow up with us with any questions you have following today's get together. So thank you all very much. If I don't see you before then, have a great remainder of the year and holidays and all of that. And with that, we are adjourned.